Strictly Sickly is a medical-related talk show. While informed, we are not medical doctors. Any advice given on this show should not be substituted for a professional medical opinion. Always consult your physician before making any changes to treatments or routines.
Hey, welcome to Strictly Sickly. I'm Sarah Hatfield, and we're here today with Kristen.
Hello.
And we're going to be discussing brain fog.
Indeed. A very lovely thing for all people.
So, first off, we'll talk about what brain fog is and what it feels like going through the experience. Then what it feels like looking back at the experience when you're more lucid. So, do you want to start, Kristen?
About what it is exactly? Because it's kind of hard to explain exactly what brain fog is.
What it feels like while it's going on, and then looking back.
Well, it's a huge disconnect between... It's really hard to explain what it is. It's just, unless you've felt it, I'm not sure I can accurately describe what it is. I just know that I can't hear myself anymore. Did you turn me way down?
I was trying to turn mine down because everything's super loud through my headphones and it's really hurting my head.
Don't turn the knob that says headphones.
Because then I'm turning her down too.
That's fine.
Okay. Sorry, guys. So, for me, sometimes when I'm having brain fog, I don't know. Mm-hmm. It just feels normal. Do you always know?
I feel like I'm kind of always having brain fog, so I actually only really notice when I'm lucid because it's so different than from what I normally feel. But yeah, it's hard to explain. You can't really concentrate. You can't really focus on anything. Sometimes you can't think of words.
Yeah.
And you just kind of...
Sometimes to me it feels like the edges of everything are fuzzy. Mm-hmm. Like when you watch an old show and they do a dream sequence. And like I'm not really... like the world is lagging. Mm-hmm. Like when you play a video game and it has lag. Like that's a big one for me.
It's kind of... I do have also the foggy kind of appearance, I guess. But it's... It's almost like everybody's 5 steps ahead of you and you're trying to catch up and figure out what everyone just said and you can't quite connect what they said.
And Allie says it's like having something on the tip of your tongue, you can't quite get it out.
Yeah.
Yeah, a lot of times like with words, it's almost like having aphasia, like a stroke victim has aphasia. It's really similar.
Yeah, I've been accused of having aphasia before because I can't think of something extremely simple. There was a day that I could not think of the word silverware for forever, and it's not that hard of a word.
Food devices.
Yeah, it's like, forks and the table you eat with it, and it took a while.
Well, it technically is you do have aphasia when that's going on.
And it's bad. Sometimes it's the simplest words. Sometimes you can't even begin to describe what the word is, so you just give up on it.
It's like when someone's like, I like a song. Well, sing some of the lyrics so I can look it up. And you're like,
I don't know any of them. Yeah.
Yeah, Dane says I forgot my own name last week.
Yeah.
Yeah.
Yeah, and it's in everything. So, you might be watching something and then you realize you haven't been watching it. Or maybe you were reading something and realized you didn't read anything on the page or you didn't comprehend any of it. And yeah, it's ridiculous and it's awesome. I love it. It's my favorite thing to have.
And then looking back on it, like mostly, like Allie said earlier, I just feel embarrassed. Mm-hmm. I feel like ashamed, even though I know it's not my fault. I don't like feeling stupid and slow.
It just makes me feel annoyed because I hate it so much. And then to look at it and go, well, yeah, I was having another brain fog thing. I just hate it, and I'm so mad, and I'm so annoyed.
Yeah, it's awkward and uncomfortable.
Yeah.
Especially, like, if I have a doctor's appointment or something, and I gotta go explain something to them.
Good luck.
But yeah. I don't even know where to start. That's why I almost always take someone to the doctor with me. Because inevitably, I will forget what I even came in for.
Yeah. Of course, you have so many things going on at one time. It could have been any of those things.
So, tell a story of brain fog. Tell a story about a mild brain fog day and a bad brain fog day.
Okay. I guess mild is just whenever I try to do my favorite hobby, which is write, and it gets to a point where the whole entire story is there. It's in my head. It is ready to be put on the page, but I can just sit there and stare at a screen for hours, and I don't know why, but I can't make anything happen.
Yeah.
And people try to accuse me of it just being writer's block or something, and it's not. It's completely different.
Now you can't have both.
Yeah, you
we were
can't
talking about this before
yeah.
the show. I have both all the time.
And mine is just, it's really annoying because I know what I want to write. It's there. It's right there. I just cannot write it down. I can't do it, and it's frustrating. It's so frustrating. For serious, it would be usually whenever serious things of brain fog happen, I just stay in bed that day because it will start as soon as I wake up, where I don't know where I am. I'm not sure what I was supposed to do today. I don't know where my pants are. I mean,
sometimes I think it's a different day. Like, I'm like,
yeah,
why is it cold outside? It's summer.
Yeah, or you feel like you slept for 24 hours, but you were only asleep for 2, and so it's really confusing. And whenever it gets that bad, I'm just gonna stay in bed. I can't.
Because, I mean, when it's that bad, I mean, I worry about things like driving.
That'd be very dangerous.
Yeah. It's just a scary thought to try and function on those days.
Yeah. And what are your stories for your mild and your...
I'm not sure if I ever get it mildly.
Yeah, that's the problem.
If I have it mildly, I might, accidentally leave the clothes in the washer an extra 3 days. Or, like you said, the not being able to write, or I have issues reading often. Like, I just can't concentrate.
Yeah, it just didn't really get in your brain.
No, I have a specific case of a bad couple brain fog days where I wake up one morning and I get on Facebook and I'm looking over the past few days and I see a picture of myself holding a bird in my house. So I go to a couple friends. I walk out of the room to go ask Steven, and in the kitchen I see this big mess. Someone has made crepes. And so I asked, is when y'all were still living there, I asked Steven and Aaron what happened. Well, apparently I came out of the room 2 nights ago and I said, I want to make, because I was gluten-free then, I want to make gluten-free crepes because I thought I had celiac disease. We went and we bought all this stuff for crepes. I fixed the crepes. I ate the crepes. I went to bed. I woke up the next morning and the cats had brought a bird in the house. So I rescued the bird. I took some pictures. I released the bird. I remembered none of that. None of it. I still don't remember any of that. Nothing has ever jogged my memory, and that's not the only time that has happened.
Yeah.
Now, my doctor thinks it's due to a potassium deficiency I get sometimes. I don't know, but the CRPS I have also has been known to cause really severe brain fog.
Yeah, there's actually quite a few things that cause it, apparently.
Yeah, so symptoms of brain fog, or is brain fog usually a symptom of something else? We had a question a little bit ago of have you asked a doctor about brain fog?
No.
See, I have, and my pain doctor says it's pretty much CRPS or the meds I take for CRPS. My general practitioner says it's depression or RA.
Yeah, I never really asked about it because I assumed it was just a symptom of everything else going on.
My
chronic fatigue and all that stuff that I have, so it's probably just part of that.
My OB thinks it's from PCOS and the hormone things. So every doctor thinks it's something different.
And it could be a mixture of all of those things, I guess.
But it is a symptom that has its own symptoms. Like we talked about, the fuzzy feeling, the disconnect.
Yeah, and kind of a drowsy feeling, I guess.
It's almost like when you have a really bad allergy day and your head just kind of feels...
Or I guess migraine, but without the pain kind of thing, where you're just nothing's really, you just want to get under a blanket and it's fine. And
yeah, that's a good day to call up a friend and go, TV marathon today.
Just bed.
Talk about all the things that can cause brain fog. So, our producer Brad wrote us up a nice list here. Stress. Chronic stress can increase blood pressure, weaken the immune system, and trigger depression. It can also cause mental fatigue. When your brain is exhausted, it becomes harder to think, reason, and focus.
Yeah, I could see that. You get a little too stressed out and your brain kind of pops a cork and then you can't really focus anymore.
Dane's GP said, I'll send you to a neurologist because I'm not qualified to discuss this. So in other words, go pay a specialist now. But yeah, it's stress, and it's hard if you're chronically ill because everything's
stressful.
stress.
Yeah.
You most likely have financial problems. If you don't feel good, you're immediately stressed.
There's always the stress of, I need these pills. How can I get these pills now? And how am I going to go to work? And what about this? And yeah, it's just ridiculous amount of stress just from dealing with chronic illness. So if that's one cause, sure, yeah.
I have a new pain. Is this permanent? Is this me now?
Yeah.
Lack of sleep. Poor sleep quality can also interfere with how well your brain functions. Aim for 8 to 9 hours of sleep per night. Sleeping too little can lead to poor concentration and cloudy thoughts.
8 to 9 hours. That's ridiculous.
My insomnia mocks this.
And I have chronic fatigue, so even if I got those 9 hours, I wake up tired. And it's like I didn't sleep anyway, so I'm sure my brain's not even sure if I slept. So.
Yeah. And recently, the estrogen patch I'm on that I've been on for a few weeks is actually really helping this. I was having severe early waking insomnia. I would sleep 2 to 3 hours and then be not only awake, but like I'd wake up with anxiety and be wired.
That's fun.
It was just awfully uncomfortable. Oh yeah, Allie says chronic illness can cause relationship stresses. Well, yeah. But it's hard to get a good quality of sleep
if you have chronic pain.
Yeah. It's almost impossible.
Yeah, because you wake up every once in a while just because everything hurts so bad. And unless you take pills for it, sometimes you're just not going to sleep through that. So you're going to end up having more sleep problems.
Yeah, and then you can tie them in together. I get stressed about lack of sleep.
Yeah, kind of back and forth. Huzzah.
Okay, hormonal changes. Hormonal changes can also trigger brain fog. Levels of the hormones progesterone and estrogen increase during pregnancy. This change can affect memory and cause short-term cognitive impairment. Similarly, a drop in estrogen level during menopause can cause forgetfulness, poor concentration, and cloudy thinking.
Yeah.
So I've experienced both of these, pregnancy and menopause. Let me tell you, when you're pregnant, you feel like your IQ's dropped about 10 points at least. It's weird, and it's a lot of at times people don't think about that. When it, with pregnancy, you become just super batty and forgetful.
Yeah.
But, do you think that's the cause for a lot of your brain fog is,
maybe
female issues?
Maybe. There's enough going on but again, it might just tie back to everything else. It may not be one pinpoint thing. It might be a mixture of all the things.
And now that I'm reading this, it's progesterone and estrogen are the ones that help this. And estrogen is what they haven't put me on testosterone yet. So I guess the estrogen is, helping me out a little bit.
Maybe it'll continue to help you out.
Well, and the hormonal changes are going to add to stress, too, because menopause turns you into a raging bitch.
Yeah. So does pregnancy, though.
Yeah. Diet. Diet can also play a role in brain fog. Vitamin B12 supports healthy brain function, and vitamin B12 deficiency can bring about brain fog. If you have food allergies or sensitivities, brain fog may develop after eating certain foods. Possible culprits include MSG, aspartame, peanuts, and dairy. Or if you have celiac disease, gluten, will cause serious brain fog.
Yeah, I always wondered, since I don't drink enough water anyway, but I drink soda, an excessive amount of soda, so it's possible that my lack of water and too much sugar, and that might also have to do with it.
Most of that info implied that it's way more common in women. Yeah. Well, also, a lot of these diseases are more common in women, like fibromyalgia, which is a known cause of brain fog.
Yeah.
And a lot of that, I think, is due not only to hormones, but we're more likely to see a doctor.
Yeah.
And not all of us, but a lot of us are more willing to go see a doctor.
Yeah, and especially since I guess in some cases that might be considered a mental thing, and I know that dudes are so mistreated anytime they go to a doctor for mental
health
health.
care,
They
yeah.
probably just don't go, which is understandable and also
I don't
sucks.
blame them.
Yeah.
Say medications. If you notice brain fog while taking medication, talk with your doctor. Brain fog may be a known side effect of the drug. Lowering your dosages or switching to another drug may improve your symptoms. Brain fog can also occur after cancer treatments. This is referred to as chemo brain.
Chemo brain.
Have you ever had a medication that...
I mean, a lot of them say do not operate heavy machinery or whatever, but I don't think any of them have ever explicitly said that they cause brain fog.
So I've been on pain meds for a really long time, and at first I was just on hydrocodone, and then they switched me to Percocet. They started me on fentanyl a few years back, and it's the same kind of class of drug. It's an opiate. But it's a lot stronger. And I noticed that all of a sudden my brain fog hit. Sorry, I think I'm developing a cold.
Get away from me.
It's allergies.
Get away from me.
It's allergies. My brain fog hit like peak levels when I first went on it, and then it kind of improved as time went on.
Isn't fentanyl the one that's like the zombie drug?
Oh, that's scopolamine.
Oh, okay, yeah.
I was on scopolamine when Brad just talked about scopolamine. Oh, Dane says gabapentin. Yeah, I was on Lyrica, the same kind of med, and that would dope me out so bad I had to stop taking it. But yeah, scopolamine's nausea med that comes in a patch form. It's for motion sickness and other forms of nausea, like Zofran or Phenergan, promethazine. But in South American countries, they call it devil's breath. You can blow it in someone's face and it almost functions like a date rape drug. It makes you super compliant. They've had people just empty out their bank accounts for them and then they don't remember it.
Zombie drug.
Because it comes from a plant of some sort. So they just scrape it and then blow it in their face. And I was joking when I was put on it that I could just start sticking it to other people and having them do what I wanted. But the dose on the patch is super low as compared to what they'd be blowing in your face when you're doing something like that.
Do you remember the trip to Crescent when you were on scopolamine and you insisted on driving?
Yes, I do remember that.
I'm surprised.
Allie was saying the Zolodex messed her up, and it did make me think back when I was on depression medication. I don't know if it would count as a side effect for it or not, but there was some that I would take that I would feel completely disconnected, and it helped with the not feeling sad
That's
anymore.
a common with antidepressants is feeling out of
it was like
out of sync.
I no longer felt sad, but I also didn't feel happiness or anything. I felt nothing, and it was awful. And
say that's what's been going on with me is my menopause symptoms seem to start getting better. I started having way less hot flashes and I was less moody, and then all of a sudden I noticed I was having no moods.
apathy, complete apathy.
It's apathy so severe that I'm not depressed anymore.
Yeah.
And that's almost like I debated with myself.
It's worse to me. I'd rather just feel sad than feel nothing.
My
It's
depression
awful.
had been so bad lately that I woke up and I was like, I'm not thinking about suicide anymore.
I'm not thinking about eating either.
Yeah, I wasn't eating, I wasn't sleeping, and I wasn't enjoying anything.
Yeah.
Like, I went back and tried to watch a show I particularly like, or go on a drive and listen to the music I like, and just none of it was fun. It was real but my depression before that was so bad that I honestly considered not getting rid of it.
Yeah.
But
So it's kind of a brain foggy thing, though, because you're kind of disconnected from everything, including your own emotions. And so...
Well, I also realized I wasn't thinking very well.
Yeah.
I was real slow and just... I wasn't having any thoughts at all, really. Yeah. Which is weird.
Kind of staring at a wall.
Because, sometimes I'll ask Steven, what are you thinking? And he'll go, nothing. And I never believed him. Now I do, because he has an apathy problem. But it actually helped me develop a new understanding for Steven.
Yeah.
Because he has low testosterone. And I think that's like a main factor in what's going on, because I've been on the estrogen for a few weeks now. And it's not really helping the apathy very much. But I get to start testosterone in a few months, so we'll see.
Fingers crossed.
The last one on this list is medical conditions. Medical conditions associated with inflammation, fatigue, or changes in blood glucose level can also cause mental fatigue. For example, brain fog is a symptom of chronic fatigue syndrome, which involves persistent fatigue for longer than 6 months. People who have fibromyalgia may experience similar fogginess on a daily basis. Other conditions that may cause brain fog include anemia, depression, diabetes, Sjogren's syndrome, migraines, Alzheimer's, hypothyroidism, autoimmune diseases such as lupus, rheumatoid arthritis, and multiple sclerosis, and dehydration.
See, I've got like 4 things on that list, so I think we're good to say brain fog's pretty heavily set in there.
Anemia, depression, hypothyroid, technically.
Chronic fatigue.
Autoimmune diseases. Yeah.
Yeah, it's just check some stuff off.
And I imagine the brain fog you'd get with Alzheimer's would be the most severe.
Yeah, because you're already pretty not there.
Do you remember you have brain fog, though?
But I wonder, since it's such a thing associated with chronic illness, people who are completely healthy, how often do they have brain fog?
I don't know. And you hear people talking about, I'm just having an off day. I wonder if that's their way of saying I have brain fog.
And maybe theirs is just super mild in comparison. I don't know. I don't really know anybody who's completely healthy to ask.
I think back and I'm like, well, when I was healthy, but I don't think I was even healthy back then. I just didn't know what I had yet.
I was healthy for a little bit, but I really don't remember having any kind of disconnects like that until the depression started.
Yeah.
So
I've also, even before the depression and all that, I've always had insomnia.
Yeah.
Like from birth.
Yeah.
My parents will whine
Vouch
about
for
that.
them.
Yeah. What are some non-common causes? We were talking about this earlier. What would be a non-common cause of brain fog?
Yeah, I don't know.
Closed head injuries.
Yeah, I guess if you got a severe head injury, it would probably cause some.
Couple.
Huh?
You've had a couple.
Oh, I've had some non-severe head injuries.
Yeah.
I've had a couple concussions, one of them being worse than mild, but less severe than severe.
It's a concussion. There's not.
They rate them. You can have a mild concussion, a moderate concussion, or a severe concussion. Because when Caitlin was in that dirt bike accident, she had a very mild concussion. Mm-hmm. I had a moderate concussion when that client of mine decided to beat my head in with a door.
Oh, yeah.
Oh, gunshot. Yeah, Dane knows somebody who had a gunshot wound to the head.
Oh.
So I would think that would cause the worst brain fog. Yeah, head injuries are so complicated too. People have been known to become
Different people.
a completely different person.
Wake up speaking a different language.
Or like, what's that dude that got the railroad spike through his forehead that, lost his whole personality because it was his frontal lobe?
Yeah.
It's...
There have been people who woke up who never played the piano, and now they can play the piano.
Yeah.
And it's
brain injuries
crazy.
do, and I've had a couple friends with some pretty severe brain injuries, like that have ended up with drains in their head and in comas, and they do come out just different.
And I bet it causes some pretty severe brain fog, especially if you are now this totally different person. Imagine that stress and confusion.
And the disconnect with
Yeah.
who you were before.
Yeah, you'd
and your
probably look in the
memories.
mirror and have no idea. And yeah, that would be a pretty severe case.
Oh yeah, Allie got a concussion in that car wreck, and I think when I got the concussion, I got one in her car wreck too, but then I got one at work, and I think we both developed something called post-concussive syndrome, which can go on for decades. I have a friend who was in a car wreck, and he got, the coup contra coup injury where your brain hits front, back, and front again. And it just... the post-concussive syndrome can be incredibly severe, which is why I'm surprised that it's not more... until football players started getting it, it wasn't super commonly known. It just... it's this thing that so many people have, even from mild car wrecks, that no one talks about.
Yeah.
Would it be concerning enough that you should go ask for an MRI? Which part would be?
Like just having really bad brain fog? I wouldn't go to the doctor for that.
Yeah, I don't think that's usually a reason people seek medical care. Now,
What would they do for it?
well, if you go and you do have brain fog, they might want an MRI because, I mean, in really severe cases, it could be a sign of a brain tumor or like pseudotumor cerebri.
Ooh, big word.
Um,
Clap, 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 clap.
Idiopathic hypertension. I forget the other word for it, but that's when you have too much cerebral spinal fluid and it's pushing
Yeah.
on your brain.
Yeah, I wonder if you're somebody who just always has brain fog, just 24/7, it's just kind of there. If that probably is something you should get checked out.
Dane says every aneurysm my grandma has makes her way nicer. Allie, why couldn't I get the weird talent injury? It's like, yeah, with all the injuries I've had, why
couldn't I have something cool?
Why can I not speak Spanish now?
Why do I not have superpowers yet?
Yeah, I know.
It's
I
ridiculous.
should be able to move shit with my mind, right?
At this point, I should be able to set things on fire with my brain.
Yes, that's totally the way this works.
Superpowers.
I'm trying to think of some other non-common causes.
Yeah, because I'm trying to stray away from the brain injuries and head injuries, but
I would think a food allergy that you don't know you have, or a food intolerance. Because if you don't know that's what you have, how is anybody ever going to sort that out?
ooh, what about trauma?
Yeah.
Like PTSD or
childhood
something?
trauma.
Yeah, if you have trauma and it really affects you, it probably
Yeah.
would kind of disconnect, and that might stick around. For,
PTSD is a really big culprit for
Yeah.
brain fog. Why would a food allergy cause it? Just because it sort of messes with everything in your body. It throws
messes
off
up
your
the chemistry.
Yeah, it throws off your brain chemistry. Like I was talking about before, celiac disease is a big and people with lactose issues. They talk about the bowel issues they have and stuff, but it causes a headache, brain fog, rashes. Allergies do all sorts of things.
Yeah. What's another uncommon one? All I keep thinking about now are just crazy traumas.
Anything that alters your electrical synapses.
Wouldn't that mostly be head injuries, though?
Chemical imbalance.
Yeah.
Does anyone have any ideas for less common causes of brain fog?
Does anyone have brain fog, but none of these other things we have mentioned?
I'd say migraines.
Yeah, that would.
But that's a more common cause, probably. Seizure disorders. If you have epilepsy, much like migraines, you generally, a lot of people get what they call an aura. Like when I was having the seizures.
You get that feeling beforehand.
Yeah, I could tell about 15 minutes before it would happen that it was coming. That's how I was able to take Xanax and make sure it didn't happen. But the aura made me real whacked out. And then you have they're tonic-clonic seizures. So you have the what's going on right then, and then you have a down period afterwards where you're real incoherent for 2 to 6 hours. Most people that have grand mal seizures sleep for 6 hours afterwards because it just takes it out of you. Would electroshock therapy fix brain fog? I think it would be more likely to fix, like, if it's depression causing it, the cause of brain fog,
Yeah.
or like bipolar disease.
Because if it's a shock therapy, that might cause more harm than good for the brain, I guess. And then, I don't know. It's such a complex thing because it's. I know that we were going to talk about ways to help it or fix it, but.
Ketamine, the only application I know for ketamine is, like I said, the depression, which in that case it would be fixing the cause, or like with CRPS, resetting nerve damage. So I don't know about that one. And I know ketamine, the people that have used it talk about how awful the experience is. So I'm not sure if I would go that way.
Allie says age. Age could cause it.
Yes, age can definitely, like, Alzheimer's was one thing, but
Dementia.
just getting older. I mean, I'm surely anyone here who's over the age of 25 has noticed that their brain is slower than it used to be.
Yeah. and you forget more, and you misplace things more often. And
Oh yeah, low doses of magic mushrooms or LSD or other hallucinogens have been shown to help depression and brain function, oddly enough.
go get me some magic shrooms.
But, if you take too many magic shrooms, then they cause brain fog. Electroshock was used my mother's father for years, and he's pretty extra foggy.
Just made it worse.
Yeah, it can. A lot of things that work for some people do the opposite in others.
Yeah.
I mean, back to pain meds. If you're on them for more than 6 months, they can cause a reaction where they actually make you in more pain. They overamp your nerves.
Oh, yeah.
So that, a lot of medications like Benadryl, if you take that for sleep, sometimes
you're gonna
it
be
makes you
wired.
hyper.
Yeah.
Things can do one thing or the other, it seems like.
Yeah.
It's either here or it's way over there.
I guess it's kind of like the if somebody has ADHD, coffee makes them tired, and so
No, that's what Steven's grandma Mimi was doing, was giving her coffee, and I was appalled at first.
you're like, why are you making them more hyper?
But then I noticed that Caitlin would be calm for a few hours after the coffee. I was like, crack her up, give her all the coffee. Now that's if it's black coffee. Like,
Yeah.
you don't want to put a bunch of sugar in it because that does the opposite.
But I figure, if it's gonna cause different for everybody, nobody's the same. It's the weed argument all over again.
Yeah.
It's not
And
not
that's
gonna help everybody. And
antidepressants. Like, I've had to try 10, 11 different.
yeah, I've been on a lot of them, and none of them have actually worked.
Yeah.
So which is why I'm not on anything anymore. But
And a lot of people, nothing works. Would Adderall be a treatment? Well, I guess if you had something severe like chronic fatigue to the nth degree, Adderall might be.
maybe again, it would depend on the person though, and how they react to
Yeah,
it.
because like if you have ADHD, Adderall makes you chill.
Yeah,
And if you don't, it makes you hyper-focused.
yeah,
But also Adderall is an extremely addictive substance.
yeah.
And
An addiction could,
I wouldn't recommend just,
getting addicted to stuff.
well, just jumping on the Adderall train, because that is a hardcore med.
Yeah.
I mean, Caitlin, just on that lowest dose of Concerta, was like, I was so wigged out about doing that, but it didn't. Like, people were like, oh, it's going to turn her into a zombie. Luckily, it never did that. Can brain fog be misdiagnosed as ADD or vice versa? I'm sure. But usually with ADD, it's, hyperactivity. So I'm not sure why that would be misdiagnosed as brain fog.
I don't know.
Being able to concentrate is what.
Well, not being able to concentrate, but I think there's some other aspects to ADHD or ADD that you don't get with brain fog.
But I guess if any doctor's just waiting to hand out
Well,
a diagnosis and get you out the door, then probably.
But I think literally everything is misdiagnosed as ADD.
So we had the talk about things that can help prevent, lessen, or make it go by faster. So is there anything you can do when you're having an episode that makes it better?
Depends on what it's from. Sometimes extra rest well, it might make it go. Like if I'm having a really bad flare, when I first started getting them, I'd try and force myself to not, to keep a normal schedule. Yeah.
I'm sorry.
Even though I was exhausted.
Okay,
And
Kat can't comment, but she said ADD isn't always hyperactivity.
yeah, that's it's different between ADHD and ADD. What was I talking about? Oh, brain fog. No, seriously, what was I?
You were saying if you haven't been getting enough rest, you try to rest more if you're having a flare.
Yeah, that's because when I'm having a flare, I used to just force myself to keep doing what I was doing before, and that would make it last longer. So I would think that getting extra rest and doing the self-care stuff would make it go by faster. Is there anything you found that's remotely helpful?
No, I have not found a single thing that makes it go by faster or alleviate it or make it appear less often. There's been nothing that I can do to make it better for me. So I guess it just, again, depends on the person and what illnesses you have and stuff. But
And to prevent it, I would think if it's because of depression or something like that, and medications work for you, stay on your medications. Don't go off them randomly. Don't miss doses.
But if the medication is causing it, then we're back full circle. And if stress is causing it, try to de-stress, try to calm down.
Yeah, Brad recently had the incident with the antidepressants where they did the opposite of what they're supposed to do, which is, I was trying to think, Effexor's the one that did that to me. It just made me angry and depressed and caused suicidal thoughts.
Yeah.
Which is, it's always weirded me out that one of the side effects for antidepressants
Is
is depression and suicidal thoughts.
Wait a second. Yeah, so I don't know. I have no advice for people on how to make it better.
But to deal with it, write stuff down.
Keep a notebook by your bed. I do that now. Tell somebody else where you have put the keys, so that whenever you lose your keys, someone else knows where they are.
Is pain a big cause of brain fog? Like, it takes so much space in your brain that your head has no room for other stuff, and that's from Catherine.
Yeah.
Yes.
Definitely.
I was talking to Andrew the other night because he was watching medical videos, and he was watching one on CRPS, and he was like, well, it stopped hurting, right? I was like, no, it hurts forever. And he was like, how do you get anything else done?
You don't.
I was like, astute observation, child. I do not. Sometimes it's all you can think about.
Yeah, and it causes the other stuff of the lack of sleep and the stress because it just hurts and there's nothing you can do. And yeah, then it would cause the brain fog because you just kind of...
And then sometimes all I can focus on is the misery. This is my forever. I'm going to hurt forever. And that takes up all of my thinking process.
Yeah.
And it's, people are like, well, just think about something else or distract yourself. I
don't think you understand how hard that is.
I wish it worked like that.
There are people who say just sleep through it, but I don't think they understand you can't sleep through that.
And yeah, pain takes up approximately 90% of all my brain function all day.
Matter of fact, I hate trying to sleep through pain.
Oh, sleeping through pain.
They can hear me.
Brad says he hates trying to sleep through pain. Why?
Because I just dream about being...
Because then he dreams about pain.
Yeah.
Yeah, I noticed after my hand got crushed, I started having a lot of dreams where I felt pain. Like someone would shoot me in the hand and I could feel it.
Yay.
I wish I could bottle my weird mood. I've never been depressed.
Oh, gosh. I don't think I've ever not been depressed.
Yeah.
So what should you tell your doctor for the condition to be taken seriously? Are there any medications?
Good luck with that.
Oh, yeah, right. Doctors already don't take physical things seriously. They don't take serious mental health issues seriously. What makes you think?
What's the second part of that?
Any medications that can help. And again, it would just depend on the person. And
back to antidepressants and pain meds.
Or adjusting currently existing meds, which they can't hear.
Adjusting your pre-existing meds. I would think that for a doctor to take that seriously, that's one of those things where you need to document and maybe have someone else come in as like a character witness.
She just zones out for hours.
And just bring it. They might not take you seriously the first time.
Yeah.
Bring it up again.
It's probably going to be just like pretty much any other thing with a doctor now. You just got to keep badgering them and just...
Yes.
Because they're not going to listen the first or 10th time.
And if the one doctor is just being obstinate and won't listen, go to a new doctor.
Yeah.
I'll answer this real quick just because it'll only take a second. Mina, I crushed my hand. A weight fell on it. I was playing on the floor and a 10-pound weight fell off the top of my bookshelf and landed on my hand. And it just caused soft tissue damage. Is there anything else?
Nope, that was the last bit of that.
Well, so does anyone have any questions that they want us to answer?
Or any crazy stories of brain fog?
Yeah. While I'm thinking of stuff, Mina, when that weight fell on my hand, I didn't break my hand, but it swelled up so much it caused something called compartment syndrome, where like all the fluid in your body will go into that compartment and then it can't get back out because of the swelling. So it swelled and swelled and swelled and swelled until it caused severe nerve damage. So they had to go in and do a fasciotomy where they open it up so you can get blood flow back to the limb. But unfortunately, they ignored me at the hospital for so long that it did irreparable damage. And I wanted to sue them, but since it's my offhand...
Yeah, it's not technically bad.
Yeah, it wasn't bad enough for...
God.
You have any funny brain fog stories?
Well, there was the time during college where I had gotten sick, and I decided to go to bed and just kind of sleep off whatever it was, because I didn't really have a cold. I wasn't sure what it was. I just felt really off. So I decided to sleep it off, and then the next day I got up, and somebody was in our dorm room that I hated him. I hated him so much. And he greeted me like we were friends, and I thought, why the heck are you talking to me? I do not like you. Yeah, and it turned out that the night before that I decided to sleep it off, I had gotten up and taken a shower, sat in the dorm common area, and had like a whole conversation with him, all nice and polite, and then went back to bed. I still don't know what we talked about, but he thought we were friends.
Are you sure you weren't drunk?
I'm sure. But I was so mad because I hated that guy, and now he thought we were friends because in my brain fog, I guess I just didn't know who he was. I still hate that guy.
Yeah, Brad, you keep bringing up this story of when I drove with brain fog.
Yeah.
And you bring it up like literally once a week. It was a stupid thing to do. I'm sorry.
Do not recommend.
I would not recommend anyone else do that. It was a bad decision. Yeah. Oh, Mina, I've been through hell and back. I wish I was as strong as you. It's not a matter of strength, I promise.
She's being forced.
I have days where I can't do anything.
Yeah.
And there are times when I've almost given up.
Yeah, I think most of my funny stories with brain fog would be how I gave up, because sometimes there'll be an easy word stuck on the tip of my tongue and I can't think of it. Aaron will ask me, well, what's words kind of like it? And we'll figure out what the word is, and I can't think of what the words around it are. So I just kind of shut down. I'm like, forget it. It's not important. I don't even want to talk anymore.
And sometimes you physically seem too incoherent to be able to function.
Yeah.
Yeah.
You do that.
And the problem is, a lot of times when I'm like that, I don't know. I'm like when I was on the Xanax for the seizures. Mm-hmm. But the problem was I had no other options.
Yeah, you were just kind of stuck that way.
Then I ended up feeling guilty, and it makes everything worse. And even though there's nothing I can do about these things.
Allie said she went to work with her shirt and panties inside out. She would often try to buckle her seatbelt on her office chair. Okay, that last part's kind of funny. Just buckle up.
How do we better care for you guys when you're brain fogged? What helps from our side of it? Just being understanding.
Patient, yeah. I'm sorry. I'm trying. I'm really trying. Just be patient.
Yeah. Be patient. Help me remember stuff.
Yeah.
Don't make, sometimes it's funny. Yeah, sometimes it's really not.
Don't make fun of me in the moment.
Yeah.
Afterward, we will laugh about it together, but in the moment, it's not funny.
It just compounds it.
Yeah.
No one likes to be made to feel stupid.
And that especially, that does make you feel really stupid when you can't think of things.
Catherine asked me a question. So nerves in your hand do repair over a very long time. Do you feel your meds have slowed the process or made it worse? So it's not just the nerve damage. It's that I have complex regional pain syndrome, which doesn't ever get better. So even if the nerves improve, the action with complex regional pain syndrome is much like phantom limb syndrome. Your brain constantly thinks that you have an acute injury. So it's constantly sending pain signals to that area. So my nerve damage might be better. I don't know for sure. But the complex regional pain syndrome, that's incurable. It can be put into remission through some pretty extreme measures, like a 6-day ketamine coma. I tried a spinal cord stimulator, which uses electricity to block out that pain syndrome, or the pain signal. But yeah, I don't know if the meds would have slowed the nerve healing process. Probably.
You might talk about that spinal stimulator a little bit, because it was causing some of the seizures, and that's when your brain fog got really bad.
Yeah, that's I got the spinal cord stimulator, and the first night after I had it, I went home and had this shaking fit. And I should have known, because I worked in medicine for so long, but I didn't figure the spinal cord stimulator could have caused it. And then Steven brought up to me that it almost positively changed the level of cerebral spinal fluid then, because they put it through my spinal, like through there and up into the bottom of my brain, because it was a real high they can put them anywhere on your back, but mine was like at C2, so it was super high up in my back. But yeah, and then I started having the seizures, and I was basically constantly incoherent.
Yeah.
And then the medications for those seizures were, really bad. Catherine says if someone has brain fog, probably don't ask them to make too many decisions.
Yeah.
The most frustrating is when I can't log into my work email because I can't remember my codes and I look like a moron.
Yeah,
Dane says don't treat me like a child.
my dad had a brain fog moment. He called it a senior moment.
Yeah.
When I went to visit him this weekend, he wanted to put in his PIN for his bank card, and he got it wrong so many times that it locked him out, and he had to call his bank. And
Awesome.
so he, I guess age, yeah.
Yeah.
It's called a senior moment or brain fog. So.
Allie says she went to work with her shirt and panties inside out.
Yeah, so I tried to buckle the seatbelt on her.
And Dane reminds me when I fell out of my car trying to get out when I forgot to unbuckle the other day. Mina says she went to work with her pants inside out. I don't even know how you do that.
That'd be so uncomfortable.
I don't know if it was just brain fog or being me. Because it's not just a normal can't remember moment. I can't remember, and I've been at it for the shit.
Yeah, for like the whole shift trying to remember. Yeah.
Yeah, ketamine is some crazy stuff. They're using it to treat quite a few things now, but they don't offer that in Texas for complex regional pain syndrome, and you have to pay out of your pocket. No insurance will cover it. So you not only have to pay for the med, but constant care for however long you're in the hospital.
Yeah.
Go to Mexico. You would still have to pay out of pocket for the hospital stay.
Yeah, but it'd be cheaper. Yeah.
It would be cheaper. Also, with all this,
tourism's huge.
with all the stuff I've heard about the ketamine, I'm scared to do it.
Yeah.
Because people say it's like the worst trip of your life. And I've got too many bad thoughts in my brain. I don't
They're
think
all going to come out.
Yeah, I don't think that's something I need to be doing.
Probably not.
So, Brad's sitting in the studio, but he's not next to a mic, but I have a question for him. You don't really have any chronic pain issues. I mean, you have a few minor ones, but no, like, autoimmune diseases, nothing like that, but you do have depression. How bad is your brain fog? None? No brain fog?
Just the normal amount that anybody would have.
And he says just the normal amount anyone would have. I was curious.
Yeah, you forget stuff here and there, but mostly my brain is overactive, which is the main source of my anxiety and depression. I don't know if they can hear that, but I have an overactive brain.
He said his brain is actually overactive, which causes his anxiety and depression.
Mina says they try to treat a migraine in the Joshua ER with ketamine. Does it help? Does it help the migraine?
I don't know. She said you
feel like you're dying. Yeah, because
but is it worth it?
Yeah, but
to
I'm
help
curious.
the
Does it help the migraine? Because I've tried everything for Stadol.
Good enough that people take it illegally. I mean, people take Special K.
It's a freaking animal tranquilizer. They give it to kids pretty frequently when they break a bone.
Because kids are animals.
But no, like if they have to set a kid's broken bone, they give them ketamine. They used to use it. My mom said when she first became a nurse, it was used a lot more often.
Yeah, but now they're trying to calm down.
Yeah.
A little bit.
Well, it's like with the opiates, they do this thing where they overprescribe, and then they go to the other extreme direction.
Yeah. Now you get nothing.
When really a midline approach is what's best.
Yeah.
I mean, when I first started volunteering at the ER, they were still using, they still had cocaine in the Pyxis for bloody noses.
Jeez.
And now they just carterize that.
Yeah.
It's weird they would use cocaine for bloody noses when it causes
bloody noses. Yeah.
Who knows? What do you think your particular worst culprit for brain fog is out of all the stuff you have?
Probably the fatigue, because I'm always tired.
That causes your brain fog?
Yeah. Since I'm so tired, no matter how much sleep I get, it's probably the main culprit of...
Haloperidol for migraines, did that help? I mean, you were in a coma, so...
It must have helped a little bit.
I think my worst culprit for brain fog is pain.
Yeah.
No, it didn't help me. My husband walked in the room and I saw him, and that's all I saw over and over. Oh, I kept hearing myself say I'm dying. That's awful. Yeah, see, that's why I'm scared. And like I hear maybe a 50% success rate in people with CRPS. And the pain's so bad that I've been basically willing to try anything. But that scares me.
I guess it'd be a flip of the coin. Is it worth it or is it not? I don't know. It sounds terrifying.
Yeah.
Allie says it's terrifying.
She says, I've never had ketamine. It's terrifying.
Yeah.
I don't know. Like, if I had a more % chance that would help the CRPS pain, then I might do it. I mean, just this week, a guy he sawed off his own leg in my CRPS group. He sawed off his own leg.
If it feels better, man.
That's a thing that people do with CRPS, is cut off their own limbs.
I saw white light and tunnel Stadol.
Yeah, Stadol.
It's the only thing that helps me stay away from the ketamine man. Not a fun trip.
I used I used the Stadol nasal spray, but that made me feel trippy bad too. But it did help the migraine. So I don't know. But yeah, I think I'll avoid the freaking ketamine.
Yeah. What's worse, pain or fog?
Pain. I think mine is the fibro and anemia and copious childhood head injuries, maybe the ADD.
I'm going to say fog is worse for me because it interacts with the one thing that I like to do. Like, of all the things, it's the one thing I hate the most is the brain fog because it interferes with the one hobby that I have.
Dane says, I never took it. They had already given me stuff while there. Then they gave me a bottle of haloperidol to take once I got home. I took the bottle and left and did research beforehand, decided I'd keep them. Yeah, no joke. That's a hardcore freaking drug.
Just telling the ketamine story, it kind of made me feel back in it.
That sounds awful. Yes. I'm sorry, that's what they use to...
Don't do the ketamine.
Yeah.
The question I was trying to ask earlier, and it's not popping up, is the brain fog is a side effect of the medication if the medication's, like your pain medication, if the pain medication's actually helping the pain, is brain fog an acceptable...
Okay, so Brad said if my pain medication is causing brain fog, but it is helping the pain, is that an acceptable risk to me? Very much so. Without my medications, if I did not have medications, I would have killed myself by now.
Here's the deal. I know it's your pain medications that cause a lot of your brain fog.
Yeah,
because we talked about it when you're...
Yes, we've talked about it.
You're sharp. You're really sharp. But when you're on your pain medication, you're more placid, you know...
Because I'm out of pain.
Yeah,
pain makes my...
But you're not as quick mentally.
I actually think the pain sharpens my brain. I think I think better when I'm in pain.
That's backwards for me. When I'm in pain, I can't do anything.
But the pain is so severe for me that seriously, if I did not have, like, because they talked about taking away medications. If they did that, I don't think I could live.
Yeah.
I think that would be it for me, because it's
Time
not...
to take you out to the woods.
I mean, it literally feels like someone scraped my skin off with sandpaper, dumped salt on it, then lit it on fire 24/7. And now it's moved up my arm into my back. My knees hurt from there. Like, it's just not... I'd rather be fogged out of my mind than be in the pain. And I think if the pain wasn't quite as bad, I'd definitely rather be in pain. Because I like my brain working.
Yeah, that's why I was saying that I would prefer, because I don't have as much pain, so I can deal with a certain amount as long as I can still do stuff that I like to do. It's whenever they kind of overload each other, and I hurt and I can't think, and then...
Yeah, that's just double awful. Dane says she got Topomex after that for her migraines, and it works. Yeah, that's a pretty common drug for that. Let me give you ketamine and make you go on a death trip, but I cannot give you a shot of Stadol because it's an opiate, which is absolutely ridiculous because ketamine's a way more hardcore drug than... Huh? Yeah, it's Schedule 1. It's way more hardcore than any opiate, but they've gotten so tripped out by this, quote, opiate crisis, end quote, that they'd rather do anything.
Dane said she decided the brain fog was too harmful and decided to accept the nerve pain instead, but I can't read that word.
The gabapentin only took my pain from an 8 to a 6. Yeah, see, the Lyrica wasn't worth it to me because it did not, like, it lowered my pain a little bit, but like I couldn't move. I was so and I tried just taking it at night, but it would still, I'd be messed up the whole next day just from one pill.
Yeah. That pain med I was taking, I would take it to go to work because I had a physical job at the time and I couldn't work without the pill, but then it made it hard to work anyway because I couldn't think of what I was supposed to be doing. And so it was constantly a toss up of, do I go to work hurting or do I go to work and I can't count to 10?
Yeah. There's also the factor that right now I'm not working.
Yeah.
So brain fog is, Brad, stop. Brain fog is more acceptable to me than it would be with a lot of people. And my kids are old enough that I can be, kind of loopy.
Yeah. And they can take care of themselves.
Yeah, it can be okay. But I also think my brain fog, you just said it was just so bad you couldn't even remember how to laugh. My brain fog is generally not that severe.
Yeah.
Which is really lucky for me. I'm grateful that it's not
that bad.
Allie says, I think I'd rather be foggy than be in pain. I can always laugh off the fog eventually. I can't with the pain. Yeah, I think that's probably because I can't speak for Allie, but mine's less severe than a lot of people are reporting. But yeah, the Lyrica made it damn impossible to function. I take gabapentin for hot flashes. They use it off-label for hot flashes. But I only use 100 to 200 milligrams a night. So I don't think that's a high enough dose to make me...
go crazy.
Yeah, it make me foggy. It also made me so dizzy I couldn't even walk, what the Lyrica did. And I lost half my hair. Yeah, I was on an antidepressant called Lamictal. It's a bipolar med or antidepressant, and it was really helping my depression. It was one of the few that ever did, but my hair started falling out like in clumps, and I was like, well, guess I'd rather be depressed.
I need hair.
Which is weird because I'm not usually the kind of person that cares about that stuff, but I guess I reached my limit. I very much care about my hair. I mean, how bad would the pain have to be before you'd think brain fog was acceptable?
I don't know, because my answer is based solely on the fact that there is only one thing I enjoy doing, and I can hurt while I do it and still be fine, but I can't have brain fog and do it. And if I can't do that one thing, then what even is the point? So I don't know. I can still hurt and do it, then we're good.
Yeah.
But it's when it's the brain fog, man.
Catherine says I have fat cells. They can apparently change into stem cells. I'll gladly donate stem cells if stem cells should fix it. I think it's cool that they can do that now. They can regress fat cells to stem cells. But
With stem cells?
they haven't. I think there's some pilot programs going on in other countries with CRPS and stem cells. But America is so weird about that sort of stuff. So I'll have to look at the kind of results they've had for that. The problem is almost any treatment with CRPS has at best a 50% shot at working.
Yeah.
Because they barely understand it.
There's a lot of things they just do not understand, and they try to make big talk like we're the smartest in the world.
Yeah.
But they don't understand anything.
Your brain's so complex. And at its root, CRPS is a neurological disorder. Mm-hmm. So it's so hard to cure stuff like that. They can't. I mean, that's why they call it remission. It's never cured.
Yeah.
Dane says I was taking 300 milligrams of gabapentin, and yeah, I didn't think I would care about looks either. But when I started going visibly bald, I had like a midlife crisis. Yeah, I tripped out. Like, I couldn't deal with that. I was like,
shave my head.
I couldn't. Like anything else looks wise, but not my hair. 300 milligrams of gabapentin. See, I take 200 a night, and it luckily hasn't done anything like bad to me yet. Yet. Hair stuff is worse for women. I don't know. I'm more okay with me going bald than I am my husband going bald. I'm the one that has to look at it.
Yeah, I wouldn't want Aaron to go bald either, but I wouldn't care if I went bald. But so,
anything else topic-wise, Brad? Questions, comments?
Stuff and things.
I think we're gonna wrap up then.
Here's your thingy to read.
I just, if someone is having really bad brain fog and it's not letting up, there's no reason you can't go to the doctor for that. Just make sure you're honest. Maybe take someone with you. Write stuff down. Always write stuff down. Self-care. Always with the self-care. They're still talking about hair loss. But we really appreciate everyone tuning in today. We'll be back next Thursday for a brand new discussion. We're not sure what we're discussing yet, but
we will discuss what
there
to
will
discuss.
be a discussion. If you enjoy our podcast, please be sure to like and share. Also, our podcast is available via iTunes, Spotify, Stitcher, and Podbean. If you would like to contact us for any questions or comments, hit us up.
Hit us up, yeah.
Hit us up on our Facebook page, facebook.com/strictlysickly, or email us directly at strictlysicklypodcast@gmail.com. Now say all that just 10 times fast.
No, Strictly Sickly is already hard enough to say by itself.
Well, y'all have a good week, and thanks for watching.
Thanks, bye.
What are you doing? Stop it!